Body Relay Clinic is a small clinic and we lack infrastructure. We don't have enough space. That's why we have less nurses. This is a poor community, so sometimes it is a challenge. That's why they go to the street to do those illegal things while we have a local clinic here. It's because we lack a lot.
Today I was interviewing a healthcare worker to find out how COVID-19 has impacted them in order to increase the services that they are rendering at the clinic.
We collect the data from tier.net. It's a system that the government uses, and DHIS. And also we interview people in order to identify the gaps that people face, barriers in accessing PrEP, barriers in accessing termination of pregnancies, and also barriers in accessing family planning at a very young age. It is very important to have relationships with other stakeholders. At first, we were struggling a lot with collecting data. We had to create relationships with the healthcare workers. We go to them and we ask them, and if we don't understand anything, they feel free to tell us. So they do trust us with very crucial information. The statistics of young people being pregnant, being HIV positive is high. So we want to minimize that. As you see, we don't want young kids to be pregnant at the age of 14. Instead, we want to build a better future for them whereby they can be educated. We have two ComServe nurses. They are very young, so they go every Thursday to the schools. So now we get young children aged 14, 15, 16. They do come ask about PrEP. They are more interested now to know what is PrEP. Okay, how do I use a condom, male or female? Well, I wanted to be a nurse, so working here has given me the love, the passion that I always had for nursing, helping people, doing a lot and bringing change. That you feel engaged, and you're working with the doctors, being the doctor's assistant, that's fascinating and that's really great. We don't want this generation of 2000 to be a generation of young mothers being infected with HIV and stuff. Why not bring the service to them? Same way we're saying that let's test and treat. Same way we should say let's give them better access. You see, right here now, not later.